The alarming resurgence of measles in Europe is a clear and frightening indication of the severe consequences of declining vaccination rates. In just 1 year, cases of measles have skyrocketed by an astonishing 787%, with a total of 35,212 reported cases in 2024. This is the highest number in the last 2 decades, revealing a sharp rise not only in the wake of the COVID-19 pandemic, but also in the context of a deeper, concerning trend: the growing gaps in vaccination coverage across the region. The severity of this outbreak highlights the vulnerability of public health systems when vaccination rates fall below recommended levels, and the consequences are both tragic and far-reaching. The primary cause of this resurgence is clear: insufficient vaccination coverage, which continues to plague many European countries. The European Centre for Disease Prevention and Control, ECDC, has been sounding alarm, noting that the vast majority of those infected, a staggering 87%, were unvaccinated. Even more concerning, among children between the ages of 1 and 4, this number rises to 90%. These statistics are a stark reminder of the dangers posed by complacency and misinformation surrounding vaccines. Measles is not a disease that can be taken lightly. It is an incredibly contagious virus with the potential to spread rapidly, particularly among unvaccinated populations. In fact, the R0, basic reproduction number, for measles can reach as high as 18, meaning that one infected person can spread the virus to 18 others. This extraordinary transmissibility means that even small drops in vaccination coverage can lead to explosive outbreaks. The situation is particularly dire in countries like Romania, where the decline in vaccination rates has been especially steep. In 2023, Romania reported a dramatic drop in the first-dose vaccination rate to 78%, with the second dose falling to just 62%. As a result, nearly 87% of the reported cases in the country occurred in individuals who were not vaccinated, and the vast majority of these cases were in children aged 1 to 4. The consequences of this neglect are devastating. Romania alone accounted for 20 of the 23 measles-related deaths in Europe in 2024, underscoring the lethal potential of this disease when vaccination coverage is insufficient. The rise in measles cases is not just a problem for countries with low vaccination rates, it is a pan-European issue. Even countries with relatively high vaccination rates, such as Spain, are feeling the effects. In Spain, while the vaccination coverage remains steady at around 96%, the majority of measles cases are now occurring in adults over the age of 30, individuals who were likely not fully vaccinated during their childhood. This demographic shift signals that even those who may have missed out on vaccination decades ago are now vulnerable to the disease. The return of measles is not confined to one region. It is a warning sign for the entire continent that complacency with vaccination schedules comes at a heavy price. The consequences of this resurgence extend far beyond just the infection rates. Hospitalizations for measles have also seen a troubling increase, rising by 79% in 2024 compared to 2019. The complications resulting from measles infections, including pneumonia, ear infections, otitis media, and encephalitis, are putting a strain on healthcare systems already stretched thin by the pandemic. These complications are not merely statistical, they represent real, human suffering. The sad reality is that many of these severe cases could have been prevented with a simple, effective vaccine. Despite the availability of a highly effective vaccine, the resurgence of measles raises disturbing questions about public trust in vaccines and the spread of anti-vaccine rhetoric. While measles is often not as deadly as some other infectious diseases, it can still be fatal, as evidenced by the 23 deaths recorded in Europe in 2024. This is 20 more deaths than the previous year, a tragic reminder that the consequences of vaccine hesitancy are not theoretical, they are real, and they are deadly. The situation also brings to light the worrying trend of vaccine-preventable diseases making a comeback in Europe. The resurgence of measles is part of a broader pattern that includes diseases like whooping cough, pertussis, which were once believed to be under control. As vaccination rates decline, the door is open for these diseases to spread once again, threatening the health of individuals and communities alike. This is not just an issue for public health professionals, It is a crisis that affects everyone, especially vulnerable populations such as infants, the elderly, and those with weakened immune systems. In response to the crisis, the ECDC is urging European countries to strengthen their vaccination programs, with a particular focus on reaching out to adolescents and adults who may have missed vaccination during childhood. The ECDC also recommends cross-border collaboration between countries to share information and coordinate efforts to prevent further spread of the virus. Additionally, the agency is advocating for pre-travel health checks and updated vaccinations for those traveling within the EU/E to prevent the transnational spread of measles. However, while these measures are crucial, the real challenge lies in addressing the root cause of the problem: vaccine hesitancy. It is clear that more needs to be done to counter misinformation and rebuild trust in vaccines. Public health campaigns must focus on educating communities about the safety and efficacy of vaccines, as well as the consequences of failing to vaccinate. The fact that diseases like measles are resurging in a region with access to free and effective vaccines is a damning indictment of the failure to adequately address these issues. In conclusion, the current measles outbreak in Europe is a stark reminder of the importance of maintaining high vaccination coverage to protect public health. The 787% increase in cases in just 1 year is a wake-up call that cannot be ignored. If we continue down this path of declining vaccination rates, the consequences will be devastating, not just for individuals, but for entire populations. It is imperative that we act now to reverse this trend, before the resurgence of measles becomes just one of many preventable diseases that are allowed to spread unchecked. The vaccine is available, effective, and safe. There is no excuse for letting these diseases return.